Hey there, fabulous people. It's Angela Chatterfield, CEO and founder of themedchat.com. And today we're diving into a topic that's hotter than a summer Botox party: board certification for plastic surgeons. Everyone asks the question, is he board certified? But very few people actually really know how to even check. So if you're thinking about getting a little nip or a little tuck, or maybe you're just curious about what separates a pro from a pretender, stick around, because the truth just might shock you. Now, board certification, let's keep it real. Choosing a plastic surgery is not the time to be a bargain hunter. And it's also not the time to skip education. But unfortunately, that's what happens. Now, you wouldn't buy a designer bag off a sketchy website. And if you did, you'd know it was sketchy, so you know what you were getting. So why would you trust your body to someone who's not even board certified? And it's not just about being board certified, it's about understanding the differences. And that's what I'm going to talk about today. Now, here's the tea. Start sipping, baby. Board certification means your surgeon isn't just a doctor with a scalpel. It's proof they've put in the hours. We're talking years of specialized training, grueling exams, and a commitment to keep up with the latest techniques. What I like to say is somebody's watching. So in other words, they've earned all those fancy diplomas on the wall. So don't sashay into a plastic surgeon's office and act like they don't matter. They do matter. It's not just about them being proud about what they've done. It's about you making a good decision, at least based on what they've done in terms of their education and their training. What the boards do is the boards force them to stay up to date. So that's another reason why it's important to make sure your doctor is board certified. Now, with all that said, not all board certifications are created equal. When this became a thing, I mean, I've been doing this since 1994. Some boards popped up like, seems like overnight. Like, I don't know where they came from, but they weren't the big three, what I like to call the big three. So let's break down the big three boards you need to know before you go what we call under the knife. So the first one is the American Board of Cosmetic Surgery. Now, some people may frown on this one because it is a board of cosmetic surgery. However, I think it's for patients to have access to all three boards at one time, not to have to look and search and figure it out on their own. So the ABCS, which is the American Board of Cosmetic Surgery, is kind of like that one friend who's all about the glam. You see, what they do is they focus exclusively on cosmetic surgery. So, if you're thinking about a BBL or even lip fillers or snatching that waist, well, these docs have done hundreds of those procedures, like it's their whole vibe. So what that means is somebody is watching. A board is watching over them. They have to submit their work. They have to go through the procedures and then have a board look at them and say whether or not they are in fact going to earn the credential. But there's a catch. So here's the catch. They are not recognized by the American Board of Medical Specialties. So while they're skilled, not everyone is impressed with their credentials. I'm just keeping it real. It doesn't mean they're not good doctors. It just means that you need to be knowledgeable about the facts. So, ready to move on to the next one? The American Society of Plastic Surgeons, ASPS. Now, the ASPS is kind of like the overachiever who does it all. Dun, 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 dun. They do cosmetic and reconstructive surgery. They are backed by the ABMS, which is kind of like having the blue check on Instagram, official and respected. These surgeons have at least 6 years of surgical training. So whether it's a tummy tuck or reconstructing a nose after an accident, they are your go-to. This is likely who would come to the hospital if you've been in an accident. This is who they're going to likely call on. It's going to be someone who is board certified by. So, number 3, the Aesthetic Society. Now, this was formerly the Aesthetic Society is the ultimate glam squad, kind of. They only admit surgeons who are already certified by the ASPS. So you have to already have that credential to even earn this one. And they specialize in cosmetic surgery. So think of them as kind of the VIP lounge of plastic surgery, exclusive, fancy, and all about looking snatched. Yeah. So it takes a lot to be a part of the Aesthetic Society. Because remember, they have to already be certified by the ASPS. Now, let's move into some common myths. I want to kind of stick a pin in those, okay? Let's clear them up. It's kind of important because myths, unfortunately, if not addressed, for some people become the truth. So let's start with myth number 1. All board certifications are the same. Oh no. It's like comparing a luxury handbag to a knockoff. Both will hold your stuff, but one is definitely better made. Myth number 2. Any licensed doctor can do cosmetic surgery. Now, that one's kind of tricky because technically, yes. The license for an MD is physician and surgeon. Surgeon signifies that there's a cut being made. But would you let your dentist do your nose job? Probably not. So if you know about it, it is better to have a board certified plastic surgeon. So how do you choose the right surgeon? It's so just hard now, right? Because ultimately what happens is you end up making choices based on marketing, picking the most popular. This is not about bedside manner. It really isn't. This is about making good decisions because you're going to have surgery. Surgery is important. There's a reason why even the worst surgeon is going to give you a big, thick stack to sign of consent forms. That's called informed consent. So part of you being informed is understanding their board certification and what it means. So how do you make sure your surgeon is the real deal and not just playing, I don't know, dress up in scrubs? Well, there are some questions that you can ask, and we always have more at themedchat.com. And of course, themedchat.com is free. Just anything for you to call, chat, email us, and get additional information. And it doesn't cost the doctors anything either. So we are truly unbiased. So one of the first questions you want to ask any doctor, are you board certified? And no, I took a weekend course is not the right answer. You also need to ask, which board are you certified by? How many times have you done this procedure that I'm inquiring about? No one wants to be anybody's practice run, and if you are, you at least want. So can I see before and after photos? Because I know a lot of people think the proof is in the pics. It's not. The before and after photos are their best work. So what I like to say is ask if you can see a before and after of someone who's had a complication. Any doctor who tells you he hasn't had any complications isn't doing very much surgery. And remember, the MedChat directory has board certified surgeons from all 3 boards in the same place. So you can compare and choose wisely. No sketchy reviews, no marketing, just the facts. All right, beauty bosses, that's a wrap. Now, you're armed with the facts to make the right choices about your body. Because when it comes to plastic surgery, knowledge isn't just power, it's safety. So if you found this video helpful, give it a like, hit subscribe, and share it with your bestie who's been talking about getting, a little work done. And remember, stay fabulous, stay informed, and always check those credentials. I'm Angela Chatterfield, and I will see you next time, beauties.